You are listening to the Horse Radio Network, part of the Equine Network family.
Hello, and welcome to this episode of the Daily Vet Life podcast, where we chat with equine veterinarians about the cases they've worked on in their clinics. I'm your host, Alex Beckstedt, Editorial Director of Equimanagement. And today I'm speaking with Dr. Jennifer Selvig about a horse she's rehabbed through a variety of issues, from lameness to colic surgery and more. This episode of the Daily Vet Life podcast is brought to you by Dechra. Dr. Selvig earned her veterinary degree from the University of Minnesota and joined Cleary Lake Veterinary Hospital, also in Minnesota, in 2007. She also worked several summers as a racetrack practitioner at Canterbury Park, and in 2023 became an owner in the practice. Dr. Selvig's professional interests include equine sports medicine and rehabilitation, chiropractic, acupuncture, and working with off-track thoroughbreds. She's on the national board of Canter USA, a nonprofit dedicated to finding second careers for ex-racehorses, and is also the current president of the Minnesota Association of Equine Practitioners. Outside of work, she owns and operates Stargazer Farm, a horse boarding and training facility, and she competes in 3-day eventing as she has time. Thanks for joining us today, Dr. Selvig.
Thank you so much for having me.
So I'm really excited to hear about the case that you're planning to share with us today, because I know it's your own horse and you successfully managed him through a lot of health issues. Can you first tell us a little bit about this horse and his background?
Absolutely. So as you mentioned, I worked at the racetrack early in my career, and prior to graduating from vet school, I actually worked at the racetrack doing other things. I was a groom and a pony rider and a little bit of everything on the backside. So during my time as a groom there, I had a horse put under my care in my shed row named Chief Magistrate. And he was 5. He had been claimed from another trainer. And I don't know what it was about him, but I absolutely fell in love with him. I think it was before my junior year of vet school. So I'd been through a couple of years. And I remember telling the trainer, I said, I don't care if this horse has 3 legs and 1 eye. When he retires, I want to take him home. He was just cool. I just loved him. He was a little bit aloof on the track. He wasn't super friendly, but I just loved everything else about him and loved taking care of him. I ponied him. I paddocked him. I did all those things. And he got claimed away multiple times from that barn over the next couple of years. So as I finished vet school and graduated and then started working on the backside, I kept following this horse. And he had been claimed back and forth between a number of different stables. And he was one of those horses that just never quit. He won on turf. He won on dirt. He would win in like the mid-level claiming races and some low-level allowance races. He hit the board all the time. So by the time he was 8 years old, he was ready to retire, and I had kind of befriended his current set of owners, and he was back with the original trainer that I had worked for. And I just absolutely begged them to let me take him. Well, the conglomerate that owned him, because he was owned by a group of people, several different groups of people actually at the time, had decided to send him up to Fargo to race back when Fargo was running races. And they sent him going 1.5 miles. He was a distance horse, but that was a long race even for him. And lucky for me, they sent him up there and he bled really badly. He was a pretty bad bleeder. And so after he went to Fargo, I think the idea was they were supposed to find someone in Canada to take him. Well, nobody wanted him in Canada because they couldn't use extra Lasix up there that he would normally use down at Canterbury. So somehow it worked out that the owner that I had made friends with got him sent back down to me and handed him off. And that was that back in, I think, 2008. So I've had this horse a really long time, back from, I think I started grooming him in 2005. So that's when I first met him. So we're going on 20 years of knowing this horse. And so I took him home and gave him some time off. He was really tight. He was a little bit sore. And yeah, the rest is history. He became probably my most successful event horse I've ever had to date over the years. But that was not without its challenges even early on when I had him. So he's become the horse that has taught me a lot of things I never knew I needed to know in veterinary medicine.
There's always one of those, yes.
Absolutely.
How old was he when he retired?
He was 8 when he retired. He had raced 69 times. He'd won, his record was 13, 13, 13. So he He hit the board 39 of those 69 times. And he was super, super sound. And even the trainer that I got him from said he was one of the soundest horses he'd ever come through. In fact, he was completely sound, even barefoot, which is really weird.
Wow.
For horses coming straight off the track. But yeah, this horse was iron.
They'd have to be to race that much. Yeah.
Yeah.
So you mentioned, I think you said it was about 4 years ago that he did finally start having lameness issues. Is that correct?
Yes. So I'll back up a little bit because there was even one before that. Before his eventing career even got started, he tried to cut off a leg, sticking it through a metal hay feeder. And so that was my first dipping my toe into rehabbing this animal. And he had completely lacerated the extensor tendon on his right hind doing that. And we had unsuccessfully tried to repair it and cast it myself. He ended up at the university having it all pieced back together by a surgeon up there and spending about 7 months on stall rest, kind of before we even got going as an event horse. And when I had finished rehabbing him from that, which involved a lot of walking him around the arena with Ace on board, the surgeon had told me, well, I really don't think he's going to be much more than a low-level jumper. Well, he laughed at that. Chief did. Nobody told him, and basically went on to do a whole slew of preliminary horse trials throughout his career, including a couple of long format events. So during that time, while he was competing, I don't think he took a lame step. In fact, he had one instance where I unwrapped him in the morning before show jumping, and he had popped a massive splint overnight. And he didn't seem to care at all. He just kept right on going. We show jumped, we finished. I think he placed. I don't remember what we placed that one, but yeah, he just was made of steel. It seemed like this horse just never, until he wasn't. He was
right.
He was this horse that kind of could do anything. And so, yeah, about 4 years ago, actually, it was late 2020. So kind of toward the end of 2019, the end of COVID, I was actually leased him out to a pony clubber at the time. In 2019, I was pregnant with my second kid. And so I wasn't riding at the time. And so she was riding him. She kind of rode him through 2019 and 2020. And toward the end of her time riding him, he came up sore a couple of times after low-level jump schools. It was really unusual. And it was, again, in this right hind leg that he had injured previously, but had never had a problem on since then. And we couldn't quite figure out what was going on. I would give him a couple of days off, give him some anti-inflammatories, a little bute. He'd bounce back. We'd jump him again, and he'd come up really, really lame. And the only thing we could find is that fetlock joint had a little bit of a fusion in it. And so I took x-rays, and I didn't see anything remarkable. And I thought, well, he probably just has some synovitis. He probably tweaked it, sprained it, did something. So I went ahead and injected it. We put just regular old triamcinolone hyaluronic acid in there. A technician that does tons and tons of joint scrubs for us scrubbed this joint that day. And he felt great. He did wonderfully after that injection. We thought, okay, well, it was just a thing. Who knows what happened? I rode him in a clinic. He did great. He was 20 years old at this time, but still sound, going. I signed him up for a horse trials. We hadn't competed in a couple of years together, but I signed him up for a horse trials. We were on our way. And that leg just ended up blowing up. And so we couldn't figure out what the underlying problem was. There wasn't a reason that we knew of for him to keep coming up this lame. And it was pretty profoundly lame. I mean, he was at the time after he came up sore again after the injection, he was grade 4 out of 5 lame. So that it wasn't great. I took him to a surgeon friend of mine who was one of my mentors. He took a look at him and kind of recommended right away we had go straight up to the university. So at this point, we kind of put everything on hold, all of our plans on hold. And I brought him up to the university and sent him for an MRI because we were like, what the heck is going on? And what they found was a massive subchondral cyst in P1, just on the weight-bearing surface under the sagittal ridge in the fetlock joint. and it opened into the joint. And it was this huge cyst, and it had become infected. And whether there was something sitting in there before I injected it, or whether something happened while we injected it, I guess we'll never know the answer to that. But it was a massive problem. And the whole joint had filled with fibrin. And so the surgeon up at the university recommended we go in there and clean it out arthroscopically. So that's what we did, or he did. I don't do that sort of thing. He cleaned it up, got him recovered. The horse doesn't recover well from anesthesia. Anytime I've knocked him out, he's always been kind of a pain and terrifying to watch get up from anesthesia. So he got up from anesthesia, did okay for a couple of days, and the joint blew up again. And in that couple of days, they were doing regional limb perfusions and some other things. They ended up, I'm trying to remember if they cultured that particular sample, if it was the next sample. But I remember the surgeon called me, and he said, I don't know what you want to do. He said it filled straight back up with fibrin. I ultrasounded it, and it's just a disaster in that joint again. What do you want me to do? I said, what are my options? And he said, well, I can go in again and scrape it all out. And I said, okay, well, but after that, what are we going to do differently? Like, how are we going to prevent this from happening again? And he said, well, we'll just have to change antibiotics and hope the culture comes back with something useful. So I said, okay, one more time. So about 4 or 5 days after his initial arthroscopy, he had a second arthroscopy, same leg, cleaned it all out again. And I just kind of crossed my fingers. At the time, I was in the process of selling a 3-year-old that I had raised myself. She was one of my first sort of homebred babies. Thank God I did that, because I needed every penny to hand straight over to the university when he left. And I was able to take him home a few days after that second arthroscopy. And I continued to do regional limb perfusions on him, as well as we had chosen IV Baytril, so enrofloxacin he got. And the darn horse cultured Pseudomonas out of his joint, which is a pretty nasty bug. Not really sure how it got there. Like I said, we're not sure if something was sitting in there from that cyst that they found, or if we introduced something injecting it. My track record's pretty darn good. I inject a lot of joints, so it would figure if the one that blew up was my own. But at any rate, he actually stayed sound that time around. He did not come back. The fibrin didn't return. Seemed like our antibiotic protocol was working. He stayed on that IV enrofloxacin for 6 weeks. It's a bit of a miracle that he didn't blow with massive antibiotic-induced diarrhea, but he did go ahead and continue to improve. We kept a wrap on the leg. And a couple days after he got home, we started walking. And this is kind of where that rehab part comes in, and why I always tell my clients that there's so much benefit in walking, because I started him out at just no more than 5 minutes. And he got pretty sore even after those 5 minutes, the first few times I took him out. But I kept doing it every day. I would take him out for a couple of minutes. And this went on for probably about 6 months. And I got him up to walking an hour a day in hand. And this was also in the dead of winter, by the way. So we're in Minnesota, and there were a lot of nights I was out there after putting my kids to sleep in about -18, hiking my horse around the indoor. And it was so boring, and it was just mind numbing. And I started listening to Audible books, which I never did before because I just couldn't handle it. We do a lot of ground poles at our barn. Like the trainer that works here likes to set up lots of ground poles. So man, we walked over poles. We walked over every pole all the time for so long. And I just kept slowly increasing the amount of time that I walked him, and I just was afraid to turn him out. One of the caveats of this injury that he had, this cyst, the surgeon warned me, you really got to be careful with turnout. The location of that cyst was such that if he tweaked it wrong, if he did a turn and burn at the wrong moment, they were concerned that he would just completely shatter his P1. And we sent this, there were a couple surgeons at the U that looked at this, one of which worked pretty closely with Larry Bramlage in his training. So lots of experience with the fetlock joint. And he said the same thing. He's like, you got to be really careful with these. Don't let them out. Don't let them run around. So I gave this thing 6 months in a stall with hand walking only. And then I did eventually get to the point where I could sit on him and walk him. That was pretty funny. I tried to ride him bareback, thinking that was a good plan. And he came close to losing me a couple of times during that period. But by the end of that 6 months of walking, this horse looked like he was ready to run another event. He had lost a lot of condition during this, and he built it all back up strictly by walking around the arena for an hour a day, going over poles with me. And incidentally, I lost about 20 pounds. So if anybody wants to understand the value of low-level cardiovascular exercise, it works for people and horses. So that was kind of the first step. And then we got him out into a paddock to kind of figure out, with drugs on board. I think we used a lot of ACE, but we got him out into a paddock. He was able to kind of function in a small area where he could see his friends. That was harrowing, putting him out there the first time. And he basically spent, by the time we got him to the point where he could be outside again, we were, spring, kind of early summer. And so he did end up spending that entire season in a fairly small area. Like it was basically a probably the size of a good size, like a really big round pen. Because I was afraid to turn him out. The surgeon said, we can't do it. So I tried to be a good client and follow instructions. What I realized was that this particular horse was going to be absolutely miserable if this was his life from now on. And I felt terrible about just keeping him cooped up like that. So I started riding him again. And through the summer, I was able to get on him and actually get him back to walk, trot, canter work. And I just said, you know what, I'm not going to put anybody else on him. This is my horse. And if something happens to him while I'm riding him, so be it. He needs to be able to move. And by the end of the season, I kind of said, screw it, and got him acclimated back to going out onto the pasture. And he never looked back. The horse is able to be out normally. At least he was then. So that was kind of our first run through. And the things that I got out of that experience with him were just sort of the value of being consistent every day with these tough cases. And this wasn't, even though this wasn't like a tendon rehab, it was technically sort of a joint bone issue. The requirement for getting him strong again was the same. And for getting him comfortable again was the same. And so I learned about some conditions that I had not experienced before. I had never seen another horse before or since with this exact same problem. And just the process of getting him back out into the pasture and kind of using the horse to tell you what they're going to want and tolerate in their life. This horse wasn't young, and I just couldn't see cooping him up in a small area for the rest of his life. So I made the calculated decision to get him back out onto the pasture, and it worked. And it's worked for 5 years now. So I'll take it.
Calling all equine veterinarians. Are you tired of feeling like you're on an island when it comes to caring for your patients? Dechra Veterinary Products is here to bridge that gap. They understand the challenges you face. That's why they offer a comprehensive line of high-quality products like Zycosan and Osphos, and empower you to offer your patients cutting-edge therapies like ProVet APC. They're not just a supplier, though. Dechra provides ongoing training and support to help you stay ahead of the curve and deliver the best possible care. Visit www.dechra-us.com to discover how Dechra can be your partner in equine health.
So we had a quiet year in 2021 after we finished that rehab. So then we get to early 2022, and I wake up go out to the barn, go to do chores like normal. And this horse is cast in his stall, sort of upside down like a bug. And it was one of those moments where you just kind of know what's happening and you know what's going to happen before you ever really do your investigation. I know probably as veterinarians, we all have those moments where you walk into a situation and you know exactly what the deal is. But you have to go through the motions for the client to be like, oh, yeah, okay, we're going to do the exam. We're going to evaluate. We're going to make decisions step by step. But like I knew right away what was happening. Mm-hmm. And I knew right away that this horse wasn't going to be treated medically if we were going to treat him at all. Just the way he looked was screaming, I would like colic surgery. But I did do the thing and I did my due diligence. I got him up. I gave him Banamine. I grabbed blood. Luckily, I have a wonderful coworker who passes my house on her way to work. And I called her and she was able to stop and grab the blood, and bring it in for me to get that going while I finished chores. So I tried to like keep my head on straight while this horse was being pretty painful, kind of up and down a few times, pawing a lot. And got all my horses out. Of course, I had my own horse trailer was having repairs done. So I had to phone a friend, ask if I could hook up to hers. Got her horse trailer hooked up to my truck, threw them on, and I've just one-way ticket back to the university. Here we go. So I brought him up there, kind of knowing what was going on, got the blood work back in the meantime. Nothing was too scary yet, but very typical colic workup at the university. They got him refluxing, of course. They threw the ultrasound on. The internist, who was wonderful, I was standing at his head, just kind of turned the ultrasound screen toward me where I could see the donuts that nobody wants to see when their horse is colicking. And she said, what do you want to do? And this is where I get a little woo-woo. This is kind of the only woo-woo moment of the whole story for me, because I'm not one of these people at all. I don't do animal communicators. I don't do that stuff. I think I talk to my horses like most people talk to their horses, a lot of times right. Swearing at them as they're doing something dumb. But this horse was standing in the stocks and he was pretty down and out, looking pretty pathetic. And he, of course, I knew he had gone through all these surgeries before, and I wasn't ever sure what I would do if he was the one to colic. And I kind of thought I wouldn't put him through colic surgery, but I looked at him in that moment and I asked him what he wanted me to do. And I was like, do you want me to do this, Chief? Like, do you want me to? Like, I will. And the caveat to this is that I did have colic care coverage on him, which was kind of the only reason I considered it at all. And I swear this horse said yes. I heard it clear as day in my head that he told me yes, he wanted to do it. And I can't explain it other than that's just really weird. and so I said, okay, take him. And I put the caveat that said if he needed a resection and anastomosis, we were going to call it, because I didn't want to do that to him. And those recoveries can be so rough, and they're much better now, of course, than they used to be. But the expense and the sort of the nastiness afterwards, I thought, okay. Well, lo and behold, I stuck around long enough for them to get him on the table, and they found a strangulating lipoma that had actually started to break apart on its own. So we had a strangulating lipoma and a mesenteric rent. And so because it had kind of started to break apart, everything was basically in really good shape. He didn't need anything resected. They removed the lipoma, they ran the whole intestine, they fixed the rent, and basically stuck him in recovery. He got back up. And this horse never looked back. He had the easiest colic surgery recovery at the U I think you possibly could ask for. So thank my lucky stars for that. He came home, and then we started another stint of rehab and walking. And anybody who's been through colic surgery, this was actually my first personal horse that had ever been through colic surgery. I'd sent, I think I've been practicing a long time. I've sent a lot of horses to the table, but this was the first one of my own that I did it. And of course it was this creature. So we went ahead and did the walking rehab, and it's usually about 90 days until they go back out. And so we did that. And we went back to our polls, and I went back to my audiobooks, and I spent many more hours bonding with this horse. Luckily, it was spring. He had surgery in March. And so it's been almost 3 years now since he had that surgery. And yeah, horse has never looked back, and knock on every piece of wood, has never looked colicky again. I think what that taught me was, once again, age is not a disease, and you really have to look at the individual animal to make the decision about whether or not to take a horse to surgery, whether or not to go through the rehab. You really have to know the horse and the personality. And honestly, like I can thank Colic Care a little bit for him still being here, because otherwise I probably wouldn't have done it. But he did absolutely great. And so that was just kind of an experience that I think was good for me to have, even as painful and horrible it was for him. I've got firsthand knowledge of rehabbing a horse through colic surgery. I can tell people exactly what it's like and what you have to do and what to expect with it. And that was yet another lesson from him. Yeah, so we get through most of 2022. Again, go back to light work. He was just kind of tooling around, doing not a whole lot, but we got him back under saddle a little bit here and there. He's doing fine. 22 years old. He didn't have to do a whole lot in his life. We get to the end of 2022. I think it was December, and we had not really any snow yet. So we've been having less and less snowy Decembers in Minnesota. And this was one where it wasn't snowy yet. The problem is our ground where I am is mostly clay. And so what'll happen is it'll thaw and get muddy, or it'll rain and get muddy, and then it'll freeze. And then you have this sort of horrible ankle breaking surface in the paddocks where the horses are. And my farm has it. Lots of farms have this problem just because of the type of ground that we have. And so it kind of feels like the surface of the moon when the horses are walking on it. And none of the horses like it. It's horrible. It's uneven. There's just points and jagged edges everywhere because of the frozen mud, and it's just gross. So long story short, we had this sort of ground happening. And Chief, through all of this, has been barefoot. Like I mentioned before, the only reason I ever put shoes on this horse was when I evented him and needed to have studs for the level that I was going. Otherwise, he really wouldn't have needed shoes ever. So he'd been barefoot this whole time. And for whatever reason, one of the days that they were out on this sort of ankle breaking paddock surface, I didn't see it, but I was told that he was running around like an absolute maniac, just with one of the other horses. They were running around playing, being dumb. And about a day after that happened, he walked in looking absolutely crippled. And like I said, this horse is not lame. The only other time he went lame, it was really, really bad. And that was when he had the 2 arthroscopies. So he just came in looking like he wanted to die, just shuffling on both feet. And of course, any vet who's been out a few years is, or maybe 5 minutes, is going to look at this horse and say, God, that horse is laminitic. But it was my own horse, and he'd never, ever shown me any evidence that he was, had Cushing's or insulin dysregulation, nothing like that. Never had any symptoms of any of that. And I was like, God, this just doesn't make sense. Why would he be so sore? I threw him on bute for a few days and hoped things would get better, and they did not. So he continued to get worse. I started realizing I wasn't going to be able to put him out, and I was going to have to get something on his feet to make him more comfortable because he was getting worse and worse. I took some x-rays. He didn't have any rotation of P3 at that time, so I was grateful for that. And I was kind of looking through the various options of different types of shoes to put on, and kind of settled on getting him into one of the ultimate shoes from Nanrick. And so I called up to order them and ended up talking directly to Dr. Redden, who, as a lot of people know, has many, many opinions and thoughts on laminitic horses. But he was really helpful in getting us outfitted with the right kind of sort of bubble shoe for this horse. And the other thing is he actually had some really great ideas on what my farrier could do in the short term, because I happened to have the farrier there one of those days, and getting him comfortable right away, because this horse was really, really sore. So I was able to get him wedged up temporarily by the farrier based on Dr. Redden's recommendation, and overnighted a pair of shoes for him that could be put on within the next day or two. And I got a crash course in doing venograms just to make sure we were going to cover all of our bases. And this was cool because I got a lot of help from my colleagues on this case. I think more than any of his other problems, this particular instance kind of blew up my brain. And I think any vet that has their own animals realizes that at some level you stop being able to be rational with your own creatures. And I have kind of a threshold for that with most of my animals. Like, I kind of know what I can handle and at what point I have to sort of call in the cavalry, because I'm just not going to be able to handle it. And I won't be able to think straight. Even if it's a case that I would normally be very comfortable handling for a client, sometimes I need someone else to be a voice of reason for my own animals. So I got some really good help with this, because it was absolutely blowing up my brain that this horse that had never had a problem and had been barefoot his whole life would suddenly have these horrible hoof problems after basically running around on the hard mud for a day. So we ended up doing some consults with both surgery and medicine at the university, talking about getting some different metabolic testing done, even though the season wasn't quite right. So we did all that. Everything came back negative. He was negative for Cushing's, even on a TRH stim. He was negative for insulin dysregulation. Now, at the time, we didn't really know much about oral sugar testing. So he did not get an oral sugar test, but his insulin and leptin were both normal. So we had that going for us. One of the surgeons at the university took time out of her day one evening to come down to my farm from the university. It's about a 40-minute drive. And she came down and essentially taught me how to do venograms on my own horse, which was amazing. And so that was just a really good experience. Was able to get those sent out. And I ended up doing a few sets of venograms to kind of track his progress. Learned a little bit about that. And my farrier got him in these bubble shoes for me a day or two after they got to my farm. And once again, this horse proves that he has 9 lives. He became instantaneously more comfortable and really never looked back from that either. Like, we had him in those they called mega ultimates for about 3 months. And lo and behold, started doing more walking rehab with him. So we went back to our arena and our poles and our late night, because now we're in December, January again, our late night walking in the cold. And yeah, he grew a ton of foot. We were able to kind of follow the protocol to continue to add, or I guess switch him into the next type of shoe. So once they come out of the bubble shoe, we put them into I guess it was a high level sort of leverage reduction setup that was nailed on. And then we were finally able, now we've kind of progressed to the point where he just wears shoes and pads most of the time. But this was really fascinating to me because I think this taught me a sort of different way to look at horses that are laminitic. I think not every horse that becomes laminitic is laminitic for the same reason. And they don't all respond to the same types of treatment and shoeing setup. In this particular case, through getting him sort of early intervention with these specialized shoes, I can say that he never developed any P3 rotation, despite having abnormal venograms and having to sort of track those through time. He actually stayed quite stable, and I give credit to the shoes for that. I think that was a good decision. But yeah, he stayed in his stall for another sort of 3 to 6 months on rehab doing that. And this poor horse was so tired of being in a stall, but we were able to get him back out. I will say since the lamanitic episodes, he really hasn't done much under saddle work. I don't think that's because he couldn't. We just haven't had time to really get him back into that. And so since we've gotten him into regular shoes, and that took probably the better part of 2022 or 2023, I guess it would have been, getting him back into regular shoes and out comfortably again. He gave me the opportunity to continue to learn more and more about metabolic disease. And it's sort of evolved with some of the new treatments that are available for metabolic horses, which is interesting. So as some of these new treatments have come out, such as our SGLT2 inhibitors, he was having this issue. He had sort of one relapse where he got quite sore. And this was after we went through a time where we tried to get him barefoot again, and we found out it didn't work. And he got sore again. And we went ahead and did some more metabolic testing. And he did start coming up positive for insulin dysregulation, even on baseline. So once that happened, I was like, well, no time like the present to start trying a new drug, right? So figured out the dosing and all of the lab work monitoring you need to do for the SGLT2s, and got him started on the paste, compounded paste. And he was actively pretty sore when I put him on it. Within a few days, I would say 3 days, maybe 4, he was completely sound.
Wow.
Looking great with no other intervention other than starting that medication. And I know that this is now something that they're studying and researching quite a bit. Right. And they've showed that this is a thing that happens, but this was, early on. And I was pretty impressed and pretty excited by it. So that was about a year ago. Actually, it was a year ago, February. He started on the ertugliflozin. Since then, I've been able to drop his dose and keep him, he is maintaining on it. He lost a little bit of weight. We keep him in just sort of regular rim shoes and pads most of the time. But yeah, he's been completely sound in his front feet where he had those, all those issues. And his lab work has been great. He decided to finally test positive for PPID this past January. So now he gets percent as well. So yeah, what I have noticed, the last thing that happened is we started noticing a little bit toward the end of last year that is his left hind, which was, we joked was like his last good leg, because his right hind had the surgeries and his front feet had the soreness from the laminitis. His left hind started to drop. And we were like, oh boy, poor buddy. Finally got DSLD in his last good leg.
Oh, man.
But, he's not on any NSAIDs. This is the funny thing, is he's not unsound on it. It looks a little, you can tell it's dropped. But like, the horse will be 25 in May. And every morning he wakes up and he's like, if you asked him to go run the Grand National, he would try. That's how he is. And so I think that this horse has made it his mission, after he was done teaching me a bunch of things about eventing and competition. He has made it his mission to teach me all the things I didn't want personal experience with in veterinary medicine. And because of that, it's funny. I probably should have started with this, but just last week, I've been planning this for a while. I finally got him tattooed on my back. So I have this horse immortalized now on my right shoulder, and he's jumping through the V in the veterinary sort of rod of Asclepius logo. And I put on there, I had them add to the design Equus Experientia Docet, and that just means that horse experience teaches in Latin. And that is this horse for me. That's what he's done. And so he will always be my sort of heart horse. People talk about that. If I have one, that's him. And yeah, that's everything that I bring to some of my rehab cases that I work on, no matter how many other fancy things that we're doing with various rehab cases, various injuries, or even if we're doing APS or PRP or shockwave or other modalities on some of my client cases, like a lot of it comes back to what I've gotten from Chief, which is like consistency, walking, slow progress, just being stubborn about it and wanting the horse to come back, I think is kind of what I've gotten from him.
Yeah, for better or worse, Chief came into your life for a reason. I agree.
Absolutely.
Man.
Absolutely.
And kudos to you for taking the time and the patience and doing everything that you did to give him a good quality of life. I mean, that's a lot.
It's been a lot, and I don't regret any of it. I mean, after everything, he did for me as a competition horse, he loved eventing, he loved jumping, and he loved running and galloping, and he doesn't owe me anything. These horses that, I had the resources to do it, and I will never regret listening to him and continuing to keep him going as long as he wants to.
Right. Well, thank you, Dr. Selvig, for sharing that really great story. I'm glad it has ultimately had a happy ending and that he's living his best life now.
He sure is.
Yeah. Well, thank you for joining us on Daily Vet Life, and thank you to Dechra for their support.
Thank you so much.